The hospital is designed to manage the mild and moderate patients for the overflow should we have a surge of patients all at once. So it has designated in it some beds closest to one of the nurses' areas for the sicker patients and then well patients. The large body can hold currently about 50 patients, and then there's a room for more ambulant patients for them to be in as well that can hold 11 patients from that. So it's set up with different nursing areas, different patient care areas, and a capacity to hold supplies, and also will be have the proper air processes, because to manage infectious disease, at that volume, you definitely need to have negative pressures available. A lot of it is the basic requirements. We definitely have oxygen capacity for all patients in there should they require oxygen, capacity to give them fluids and rehydration and intravenous medications, the ability to monitor them just as in any hospital. So it's set up to provide quality and standard of care as that and the capacity to manage acute emergency while awaiting transfers. But it won't have the capacity for vented patients, for instance. That's not the design in it. It is more for the lesser ill patients. For patients that require ventilation, we have the capacity to manage them for a brief period of time, and then while they await transfer to the hospital. Well, NAOC is what manages national crises, and COVID-19 is a national health crisis, but it's a national crisis. So the role of NAOC is critical in the creation, in enabling the field hospital to come into being, because it allowed the coordination among all the different services and spheres of government and private that were required to bring this into being. Working on this project has been very interesting, very fascinating to pull it together, to watch all the different teams work together. But it is also the work we pray never gets used, because for us to need the field hospital, it means that all of the hospitals are full, and that we really are facing a true public health and medical and national emergency, which is the one thing all of that has been trying its best to avoid. We can't stop. What we're hoping to do is slow down the rate of infection, because what people often forget is that none of us naturally have an immunity to COVID-19. And while we clearly have a lot of people who have gotten infected and have had no significant clinical outcomes, there are people who will. And that could be me, it could be you, it could also be your mother, your grandmother, a child, someone you care about. And that isn't a hoax. You can see it play out in every country in which surges have taken place. I would say I enjoyed the process. I worked with a lot of great people within HSA who I already know work hard, who do great things. But it was wonderful to see such a collaboration across all of the different facilities and arms of government and public sector. And please stay home, wear your mask, wash your hands. It's still important, even though things look better now.